Good morning. This is Dr. Timothy Scott Beck here at Life Point Medical. Life is good this morning, and I hope it is for you. Certainly a pretty day outside. Let's talk about things. Okay, this morning we've already had a slew of people come through the drive-through who are positive for COVID, and some of them are really sick. And as much as I want to declare victory over this virus, it's still around. Like I said, we've already had a bunch positive this morning. Okay, so please be mindful of that. I'm also realizing, I've talking to lots of people about their vaccines, and it doesn't look like the people who are vaccinated are going to get vaccinated at this point. And I still will have that conversation with you though, and try to help you make an educated decision. Okay, but I can't argue with folks, so I just have to try to be an advocate for the truth and the medical knowledge that I have. And I get questions about which vaccine's better and stuff like that. And I really can't give you that any legitimate information on that. I've had some hints, like I've heard word that the Moderna is better. Okay, but I haven't been able to find credible information so that I can feel comfortable dispersing it. So again, we're here for you though. If you do get COVID, we're here for you. If you want to talk about the vaccine, we're here for you, period. And there were 2,096 cases reported overnight, and that's up 12 from yesterday. No more deaths though, thank the Lord. All right, let's talk about arthritis. So I will give you a little pearls on this thing so you can figure it out. So really there's two types of arthritis that we want to talk about: inflammatory arthritis or autoimmune arthritis, and then you got osteoarthritis. So when we talk about arthritis, we try to do them. First of all, I had a patient, tell me they were grieving about their arthritis. They were complaining about their arthritis, and the only thing is, I want everybody to live long enough to have to deal with arthritis, okay? So that is a sign of wisdom. It's a sign that you've lived a good long life. And this is the osteoarthritis, the age-related arthritis. So it's not always a bad thing to have arthritis. It means that you've lived long enough to have to deal with it. Now that's osteoarthritis. Okay, so the two types of arthritis: inflammatory, and then you've got age-related arthritis. And the age-related arthritis is the osteoarthritis. That's what you get from years and years of wear and tear, walking, doing repetitive tasks, typing, whatever it is. And it's painful. And we usually can mediate that with Tylenol or some of your low-dose type anti-inflammatory medications. Even though we don't like you to use those a lot, we can get some relief. And one of the things that I always do for people who have osteoarthritis is to try taking 2 extra strength Tylenol every morning. Now, mind you, you don't need to do this if you have liver disease or you're on any kind of other type of Tylenol product. But I have found that people who have mild to moderate osteoarthritis get a great deal of relief from taking a couple of Tylenol first thing in the morning. It loosens them up, gets them going real good. Now the other half of that is called inflammatory arthritis, and that's caused usually from your body's attacking itself. And there can be several types. The main type, the one you hear about, is rheumatoid arthritis. And I'm always on the lookout for rheumatoid arthritis. I'm always trying to make sure that if a patient is complaining of arthritis or joint pain, I make sure I differentiate the one from the rheumatoid and the osteoarthritis, and I can usually do that through lab work, because we have a panel of lab work we do if we think you've got an inflammatory process going on, and we can just plug it in real quick and it tells us how much inflammation you got in your body and what's going on from that standpoint. So that's all pre-programmed in, and anytime I'm worried about somebody having inflammatory arthritis or autoimmune disease that's attacking their joints, I can click on that button and it'll put in the labs that I need for that. Okay, and usually if you are positive, you have to go see a specialist. You have to go see a rheumatologist. And the reason you need to go see a rheumatologist is because they have these great new drugs that they're using to help people with their arthritis, and they work really good, and they don't have a lot of side effects. So I usually do call in an expert in the field of rheumatology to help with this, or a specialist in that field. So that's why I have to send you there. Plus, they help me differentiate things, because rheumatology is quite a difficult science and art form, and it takes a little bit of intuitive nature to be able to differentiate these autoimmune diseases. And that's why rheumatologists are really smart people, because they're trying to figure out this whole thing. It's extremely complex. So anyway, that's my explanation of your arthritis or your joint pain. It's brief, but I gave you the general overview for it. If you have any problems with arthritis, or you think you've got arthritis, or you're worried about you having arthritis, let us know. We'll help you figure it out and help you get treatment for it. All right, that's all the stuff today. Remember, Place of Hope's still selling bricks, $100 or $200. We got the applications here in the office. Please come by if you want a brick, and you can memorialize somebody or something in your life, and it'll be there forever. All right, this is Dr. Beck signing off today. Call us if you need us. Have a good one.